when we're thinking about things that we can do to support our immune system health, how important is sleep?
Oh, it's probably the most important thing that we can do. It's so huge. There's so many aspects to sleep. There have been studies that have shown that if you don't get enough sleep, your antibody titers after a vaccine are not going to be high. We've shown there were studies that have been done where they took college students, which are our favorite subjects to use because they'll do anything. When you drop rhinovirus down their nostrils, that those that have had a better history of sleep in their past tend not to get infected with rhinovirus. We know that cortisol levels are connected to how much sleep you get. We know that slow wave sleep, which is usually in the beginning part of the night before 12 midnight, is connected to growth hormone. It's connected to physical well-being, mental well-being. I mean, the list goes on and on and on about how sleep and melatonin. Melatonin is a huge anti-inflammatory medication. So just that by itself is an incredible tool to have, melatonin in the body. So this is basically the bottom line when it comes to sleep. Go to bed early, get at least 7 hours of sleep, and wake up in the morning and feel well rested. That's really the bottom line with sleep. We can get into the details about why the first hours of sleep before midnight are so important. We can talk about slow wave sleep and growth hormone, which is the essence of the fountain of youth. Growth hormone is secreted when you're young. It gets less as you get older. We can talk about what's happening to society in general, and we can talk about what it feels like when you say, I need to get my sleep, and how that is negatively looked upon in society as weakness. We can talk about the people moving into the cities, traffic, having to get up earlier in the morning and then getting home late at night. And our culture is to relax and watch television and kick back and eat big meals at night and go to bed late. I mean, there's so many things that we've done wrong in the last 100 years that impact sleep. And here we are.
Yeah, well, I want to talk about all those things because I'm incredibly fascinated with all those topics. But I guess that top line again is that the things that we can do, if we take a few simple steps to try and improve our sleep health, we can have a profound impact on our immune health. But I guess it's a lot easier to pop a vitamin D supplement, isn't it, than actually have to proactively change our lifestyle. So again, Swiss cheese model. We're going to talk about doing multiple things. The more of them we manage to do, the more robust our immune system health is going to be coming into the winter, which is going to help prevent, yes, risk of viruses, but also help reduce our risk of all kinds of other immune-mediated inflammatory conditions, whether that be heart disease, strokes, whatever it is. Having our immune system work better is always going to be a good thing. So with sleep, let's start by talking about why it's the first hour or two, those hours before midnight, as you say. Why are they so important? Because we've heard that for 50 years, 100 years, that an hour before midnight is it worth two after? But you think, is there any science to this, or is this just an old wives' tale?
No, it's absolutely it's amazing. I was reading some writing from a health journal back in the 1800s. You're absolutely right. We've been seeing this for 100 years. A writer by the name of Ellen G. White. She's on the top 100 Smithsonian influential Americans of all time, and she wrote that saying. She said 2 hours before midnight is worth more than 4 hours after midnight. And of course, they had no idea what slow wave sleep was at the time. So here's the point. Slow wave sleep is one of the stages of sleep that you get into early on in the night. And as the night goes on and on, it gets less and less and less. And what takes over is REM sleep. REM sleep is a completely different form of sleep. It's where you dream, you're paralyzed, your eyes move around. And it's also helpful, but it's helpful in a different way. That slow wave sleep that we see primarily towards the beginning of the night is coupled with growth hormone secretion. So this is the reason why that kids who get lots of sleep early on tend to get more growth hormone, and that helps with growth. It helps with physical restorative sleep, mental restorative sleep, and that's when you can get it. If you go to bed late, your circadian rhythm, which is part of the regulation of when you sleep and what stages of sleep you're in at what time, are not going to allow you to get that deep, slow wave sleep. And so you've got to go to bed early. Now, the problem is, here's the problem, is that circadian rhythm, if your brain and your eyes are subjected to light late into the evening, that is over time going to shift your circadian rhythm to tell you not to go to bed at 10 o'clock. It's going to tell you to go to bed at 12 o'clock. Or as some of you who are listening here in the audience, maybe you're night owls, you go to bed at 1 or 2 in the morning. That is, you say, hey, look, I just can't go to bed before 1 or 2. I'm not tired. That is because your circadian rhythm is somewhere over the Atlantic, as opposed to being in UK time. For those of you who are listening to UK, what I mean to say is your circadian rhythm is shifted, and the reason why it's shifted is because you've exposed your eyes to bright light at 7, 8, 9, 10, 11, 12 at night, either watching television or looking at a laptop, watching the news, turning the lights on, and so the way to get that back. There's 2 things that you need to do to get that back. So you're getting sleepy at 10 o'clock and you can actually go to bed and get the benefit of that sleep is, number 1, stop exposing your eyes to bright light at that late hour. Dim the lights, turn things down. You know, a lot of people tend to have this filter on their iPads that make it, instead of blue light, it goes to red light. Well, there was just a study that was published a few months ago that showed that that's worthless. It doesn't work. It's better to just turn the whole thing off. So that's the first thing to do. The second thing to do is that when you get up in the morning is to expose your eyes to bright light. And what that will do is it will start to advance your circadian rhythm. So instead of feeling sleepy at 1 or 2 in the morning, you're starting to feel sleepy at 9 or 10 at night, and you're starting to come into that better sleep pattern.
Yeah, it's always great to hear these things. I think many of us need to hear these things repeatedly. We hear them, we start implementing it, then we get back into bad habits. So it's always great to have reminders from world-leading experts like yourself on just how important this is. But again, it speaks to light, right? The human animal has evolved around lots and lots of light, and light at the right times, and we've kind of ironed out and sort of got rid of these natural rhythms. We spend too much time inside. We're stuck with these devices right in front of our eyes late at night. And what's interesting about that study, that the internal devices within these within the software and the programs may not be working so well, or as you put it, are worthless. I tell you one thing I've found useful with patients and myself there's some I think it depends on which company you buy from, but I think there are some really good blue light blocking glasses that I know some people find incredibly helpful. I know my wife, when she first put them on maybe 3 years ago, and she would at the time maybe look at screens in the evening and, like many of us do, she popped them on, and within 20 minutes, she was just yawning. And what's incredible is it just shows how many of us actually have artificially pushed our circadian rhythm back. And actually, a lot of us think that we're night owls. And I'm not saying none of us are at all, but I think many people who think they're night owls actually don't realize the impact that the artificial light is having on their circadian rhythms. And you take a lot of these people camping, and you find actually, no, they fall asleep at 9:30, 10 o'clock, but keep them at home, they can't fall asleep till 1 a.m.
Yeah, exactly.
Yeah.
No, it's important to have that cycle. That's a very important cycle, the circadian rhythm cycle, in terms of getting sleep so that you can be ready for the next day.
I think a lot of people have heard these days about blue light at night, but less people have heard about the importance of natural light first thing in the morning. And is that something is that something you're getting a lot of feedback on from, you make all these incredible educational videos through MedCram, you're helping so many people. Do you get feedback from people that, I kind of knew about blue light, doctor, but I'm not doing it, but I knew about it, but I wasn't aware of how important natural light is first thing in the morning?
Yeah, there are some people that relate to that, that haven't heard it, that haven't seen it, that they start to do it, and then there's an improvement.
Yeah. In my first book, which came out a few years ago, which was in the UK, was called The 4-Pillar Plan. One of my recommendations around natural light was like, look, yes, it's important. Try and get 20 minutes of natural light first thing in the morning. And maybe if you have a morning cup of tea or coffee, get outside in the garden and drink your cup of tea or coffee in the garden. And I know when I go around the country here in the UK, many people come up to me and say, Doc, for the last 2-3 years, I put my fleece on, I'm in the garden with my morning cup of coffee. So again, there may be someone listening to this or watching who thinks, actually, you know what, I might start trying that, because you're going to have your hot drink anyway, but why not have it and set your circadian rhythm up for immune health at the same time, right?
Yeah, and that actually brings up a whole nother issue there as well, which is, in science, we always try to reduce things to their lowest common denominator. So in other words, we've said here, and someone listening to this might think that the entire reason why we need to go out and go into the sun is because of vitamin D. But that's actually not the case. And you're not saying it, I'm not saying it, I don't want anyone to think that. There was actually a recent study that was done that showed that there was a reduction in COVID-19 mortality in people who went outside more, and they couldn't relate it to vitamin D levels because the vitamin D levels that they were getting at this latitude could not have made a difference in terms of COVID-19. And we may know this because we know that there's a condition called SAD, S-A-D, seasonal affective disorder, and it's obviously related to the amount of sunlight people are getting. And so there may be something more when you're recommending people go outside to drink their tea or coffee in the morning. Not only are they getting light from the sun, they may not be getting enough vitamin D because it really needs to be overhead. The benefit they may be getting is something maybe outside of what we know is happening with vitamin D. I mean, there's fresh air, there's ventilation, you hear the birds chirping. There was a recent study that showed that the more green that you see in your daily life, it improves your overall health. These are really interesting things that we're starting to find out, that maybe we've moved from the outside to the inside, and maybe we didn't do as well as we could have done in terms of health in the body in that change.
Given how important light is, and given that you are a practicing acute care physician, do you ever wonder whether in the intensive care units or in the wards that we could sort of upgrade the lighting? Because I know, from working in hospitals, or I remember when my dad was really sick and I spent a lot of time in hospitals with him. There's a bright fluorescent lighting in the wards in the evening when patients should be sleeping. There's bright lights going on. It's noisy. You must see it. And of course, things take time to change, but given how important light is, do you feel that hospitals need to do a better job of actually upgrading the light systems to help support people's health?
Oh, let me tell you, it is so frustrating. These things are built like prisons. They've got these tiny windows, and the lights are on. And I'll tell you, the night shift and the day shift come in and out of the intensive care unit. The patients don't know whether it's night or day. They get this thing called ICU psychosis because there's beeping and whistles going off at all times. What we try to do now is we try to turn the lights down. We try to minimize interaction with the patients at night. We try to open up the blinds. So we try to work as best as we can with what we've been given, but we can't put windows where structural walls are. So in the new constructions, we're hoping that they're going to take this into consideration. I noticed though on television shows, the hospital rooms are these bright huge rooms with windows everywhere. Unfortunately, that's not the case in the hospital that I work in.
I want to talk more about sleep, but maybe we'll come back to that later this time, because I want to make sure that people who are tuning in know that there's multiple things that they can do to sort of take control of their health and help, improve their immune system health. We mentioned vitamin D, we mentioned sleep and how important it is to try and prioritize that. We touched a bit on food before, didn't we, around high fructose corn syrup? And I wonder if you might want to expand a little bit on food and how that impacts our immune system.
Yeah, so this is very controversial because, boy, you can't tell people what to eat or what not to eat. It's a very personal choice. Let's face it, it's going into their body. So I realize all of that, but let's look at some of the data. And this goes way back. They've been looking at diet and food and inflammation for a long time. There's actually been kind of a standoff between the United States data and the European data for some point there. A lot of the US data was looking at meat and vegetarian diet in terms of longevity. And there was a number of studies that have come out in the United States that showed that it didn't really matter whether it was processed or unprocessed meat, processed meat being like cold cuts, sausages, things of that nature. And red meat is just obviously the meat that you buy at the supermarket. All of those things seem to be associated with, particularly red meat, particularly with inflammation and coronary disease, cardiovascular disease. And then came the EPIC study, which was a European study, a very large, heterogeneous, multi-nation study that looked at the same thing. But in their study, they found that cardiovascular disease risk was only associated with processed meat, not so much unprocessed meat. Well, this went back and forth for a number of years, and it's interesting because the data now is seeming to go back, even the European data now. There was actually a huge UK biobank study that was published about 6 months ago that showed, again, epidemiologically, that both processed and unprocessed meats were associated with cardiovascular disease. And the question has always been, why particularly red meat? I mean, it's not white meat, it's not fish. What is it about red meat that seems to increase inflammation, particularly in the vasculature and in the colon particularly, which is obviously where the food goes? And as of late, there has been some interesting advancements in the understanding of what's going on. And really, it boils down to something called sialic acids. There's a group out of UC San Diego, University of California, San Diego, that's looking at this, and also a number of other groups, particularly in France. What are sialic acids? So if you can imagine, whenever you look at the proteins on the cells of surface, we've seen a lot of animations now because of coronavirus. They'll show you these spike proteins on the surface of the cell, but that's all they show you. They're actually not showing you everything. On top of those proteins are glycoproteins, and then on top of those are sialic acids, which are little sugar molecules. In fact, if you were to picture my arm would be like the protein, my hand would be the glycoproteins, and then on the very tips would be these sialic acids. So what are sialic acids? They are sugar compounds. And as it turns out, humans only make one type of sialic acid. And I'm going to get a little bit nerdy, wonky here, but it's called Nu5GC or Nu5AC. Nu5AC is the type of sialic acid that's produced only on human cells. Now, we have a gene in our body that used to produce Nu5GC, but it's been irreparably damaged, and there's no human on the planet that makes Nu5GC sialic acid. So if you were to look at the surface of human cells, they would be completely covered with sialic acids of the Nu5AC type. I'll just call that AC from now on. Now, if you look at animals, mammals particularly, so red meat, mammals, they make both AC and GC. And so the problem is that when humans consume animals that have Nu5AC and Nu5GC sialic acids on their surface and ingest it, it gets absorbed into the body. The body can't tell, the human body can't tell whether it's AC or GC. And they put GC onto the cell surface in the body. So to the immune system, which is not used to seeing AC, they see GC now, and they see that as a foreign substance. There's been some great research out of France that have looked at this, where they actually painstakingly asked everybody for their diet. They saw what kind of foods they ate. They went out, measured the GC content in those foods, and then went back to those same subjects and were able to measure anti-GC antibodies. And they found a correlation with the diet, that the more GC they ate, the higher the antibodies in their blood. And they felt that this caused what they call a sialitis, or an inflammatory condition. And so they were able to connect these antibodies with the risk for colon cancer. And they believe this is also involved with inflammation in terms of coronary disease and cardiovascular disease. So it seems as though there may be a connection there. So when you're talking about immune system and diet, what you don't want to have when you're talking about COVID-19 is a hyperinflammatory condition, because it's just going to knock you into the hospital with BMI and cardiovascular disease. So that's an interesting development that's just been published here in the last few months. And there's other things we could talk about, but that's one of those aspects that I think are interesting.
Yeah, I mean, it's super interesting. And as you were sort of discussing that, you were talking about how the science is moving on, as it always does. And, we look at these epidemiological studies, we try and make conclusions, and we look at more, and it sort of seems to advance our understanding or potentially contradict what we had before. And I think it gets sometimes with diets, incredibly confusing for the public to actually follow what they should be doing. Certainly my view, having looked at a lot of this science, and actually for at least 10 years now been actively helping my patients in a more chronic setting than yours change their diets. The truth is, I have found that if people stick to minimally processed foods as much as possible, the truth is I've seen patients do super well on minimally processed vegan diets. I've also seen patients do really well on minimally processed diets which contain red meats and a lot of fish. And my clinical experience has led me, in conjunction with the research, to feel that it's that unprocessed nature of the food that seems to make the biggest impact that I can see. But also, I think you mentioned red meat, but I guess it's also, what are you having in conjunction with that? Are you having lots of broccoli and kale and antioxidants and blueberries and raspberries, which may, which is going to be different than if you're having that red meat with, fries and highly processed breads. Do you know what I mean? It gets really complex, doesn't it? And so how would you then summarize all that and give your patients a recommendation? Say, look, these are the things I feel you should be doing with your diet to help improve your health at the moment.
Yeah, well, I mean, obviously there's a lot of room for nuances in terms of the diet. I think we both agree that the processed foods need to go. Whether or not they're red meat or not red meat, there's plenty of processed foods that have nothing to do with meat that are probably not good for you. There was recently a study that was published, though, looking at this idea of red meat and carbohydrate. So I know a lot of physicians that want to be very healthy and they want to do healthy things, and they choose to have high protein, low carbohydrate diet. So you've heard of the paleo diet, and you've heard of, the Atkins, I guess was the old term for it. They recently looked at that in a study that was done in a network of physicians, about 3,000 physicians in France, Spain, Italy, Germany, UK, and the United States. These were physicians on the front line dealing with COVID. And this was a case control study where they looked at diet, and they asked them, what kind of diet do you ascribe to? Do you ascribe to a plant-based diet, a pescatarian, vegetarian type of diet, or a high protein, low carbohydrate? So that's key there, is the low carbohydrate, because obviously carbohydrates get sort of this rap of being inflammatory. And what they found was, in terms of COVID-19, after they adjusted for age, after they adjusted for the type of physician that they were in dealing with COVID-19 and socioeconomic, all those sorts of things. Of course, these were physicians, right? So there's not going to be a lot of difference there. They found that those that were on the high protein, low carbohydrate diet had almost 4 times the risk for moderate to severe COVID-19. That wasn't a causative study because it was case control, so it was an associative. But you've got to ask the question, is what were they doing that made them 4 times at risk? And again, I go back, in my mind, at least, to the risk of inflammation. You've got the SARS-CoV-2 virus. It's attacking the ACE2 receptor. The ACE2 receptor is one of those things that converts angiotensin into angiotensin 2 into angiotensin 1,7. So in other words, it's taking things that are very oxidative stress and turning it into reducing agents. And then when the virus binds the ACE2 receptor, it knocks it out. So now you have this oxidative stress test, essentially. And those people that are on the edge, you can imagine on the edge of a cliff, they've got diabetes, hypertension, high BMI. That's like a big wind blowing. Those people that are far away from the edge, from the cliff's edge, are not going to fall over. Those that are right on the edge because they've got diabetes, hypertension, they're going to fall over, and those are the ones that end up in the hospital. So I'm looking at this from an inflammatory standpoint. And if that's the case, looking at the data, from my perspective, I would say, yeah, definitely get away from processed foods, no question about it. And I would, as the saying goes, eat less food, more plants.
Yeah. You mentioned the term oxidative stress. Could you explain what you mean by that for some people who may not be familiar with it?
Yeah, so oxidative stress is a term that is used in metabolism, that when there's a lot of metabolism going on in your body, there are chemicals that are produced that have electrons on them that need to be taken care of, and they could cause problems with other systems in your body. So we'll name some of them: hydrogen peroxide, hydroxy radicals, superoxide. All of these things need to be dealt with, and the body actually has ways of dealing with it. But the ways that it has of dealing with it uses up products. So for instance, glutathione is used in glutathione peroxidase, which is an enzyme which reduces things. You've heard of N-acetylcysteine, which is a supplement that you can get over the counter in most places. That's a product that can be used to reduce things or antioxidize. But you can also find these things in nature. So any berry is going to have things packed full of antioxidants. Yeah. These are things that reduce the oxidative stress of the body, which is important to have when you're talking about infections and immunity. So raspberries, blueberries, boysenberries, gooseberries, strawberries, the list goes on and on. All of them are just packed full of these things. In fact, the chemicals themselves, the antioxidants, appear to be red and blue because of the way that they absorb light. And so these structures are just amazing. Beta carotene, carrots, blueberries. Anyway, all of these things reduce oxidative stress. Oxidative stress is bad because oxidative stress will cause inflammation. It damages DNA, and it does really bad things to the body. Can cause cancer and inflammation.
You shared some of your philosophy around diet last time, but instead of focusing on what we eat, I thought this time we could focus on when we're eating and what the benefits are when we eat in certain time periods.
Yeah, this is probably, more than anything we've talked about today, a game changer, because this is relatively new information, as you mentioned. Some of the research that's been coming out, and it goes along with exactly what we've been talking about. It's what we're about to talk about now is not what we're eating. We've talked about that, and many people have talked about that. It's simply when you're eating. That can have a tremendous impact. And it goes again about what we're talking about, where there's certain times of the day that your body is, quote, taking out the trash, if you want to put it specifically. And if you're doing something that never allows your body to take out the trash, why would we expect the trash to be taken out? And so what we're talking about here is a term that's been used, intermittent fasting. I prefer time-restricted feeding as an answer. And what we're really saying here is that, are we allowing our bodies to be in an unfed state long enough to do what it needs to be doing? So let's talk a little bit about this. When you eat something, obviously you're eating. It takes you about maybe half an hour or an hour to eat. And then after you're done eating, the thing that you've got to understand is that your body is now completely different in terms of the metabolism, in terms of the proteins that are being activated, than it was before you ate that food. And it will stay in that, quote, fed state for a good 2, 3, 4 hours until you stop eating. And then after about 2 or 3, 4 hours, it then starts to go back into its, quote, unfed state. And so you can think about this in terms of two states. Your body has a fed state and it has an unfed state. And obviously we need to eat, we need to get calories. But if we spread the meals out in the day so that they're very far apart, and we never allow our body to go into its unfed state, we extend the fed state of our 24 hours and we limit the unfed state. Well, what we're finding out is that has tremendous consequences. As we talked about before, when you eat, there are certain proteins that regulate glucose, proteins that regulate appetite, things that regulate metabolism, inflammation, obesity, fats, proteins, how all of these things are dealt with, blood flow to the stomach. These are just some of the few things that we're talking about. When those things are constantly been left on, there are certain metabolic problems that occur. So imagine someone who grazes every day. They've got snacks out and they eat constantly. They've got this, they're constantly putting things in their mouth. They are essentially feeding the entire day. And the only time that they don't feed is when they're sleeping at night.
To make sure you're taking action after watching this video, I've created a free breathing guide that's going to help you reduce stress, calm your mind, and boost your energy. In this guide, I share with you 6 really simple breathing practices that work immediately. Even just 1 minute a day will start to make a big difference. To receive your free guide, all you have to do is click on the link in the description box below.
So let's talk about, since we don't have a lot of time, let's talk about what are the things that is emerging. What is the emerging data? The emerging data is that having a restricted time of the day where you eat, and outside of that where you don't eat any calories. So what could you do outside of that time? You could drink water because there's no calories in water. You could even put some lemon in the water if you wanted to. I think that's fine. But not eating any calories. As soon as you would have calories, you're breaking your fast. What we're noticing is that if we restrict that period of time to about 8 or 10 hours a day, then we start to see some amazing things in terms of transformation in the body, in terms of metabolic improvement, in terms of improvement with inflammation, in terms of actually, according to a new study that came out of China, reducing even hemoglobin A1Cs in diabetes. So there's just tremendous amounts of information. You tell me where you want to go and what you want to talk about.
Well, I mean, that's super fascinating. Appreciate you sharing that. It's so simple, isn't it? Actually, at its core, what you're talking about there, it's like basically saying that we're not designed to constantly be digesting foods. That's kind of it in a nutshell, isn't it? Really, we need these periods of time where the body is able to focus on other things rather than just digesting. Yet it seems like such an alien concept in this modern culture where we, eat so much, so regularly, so late in the evening as well. And this is something actually, Roger, I've been utilizing with my own patients for many years now. And, initially there was only really animal studies there to suggest that this could work well. And with some patients, I thought, well, there seems to be a reasonable amount of evidence. I can't really see the harm here to try this with some of my patients. And I would see incredible improvements, whether it's in reducing weight, blood sugar control, sometimes sleep quality gets better sometimes when people are practicing time-restricted eating. Irritable bowel syndrome symptoms can often get better. So from a practical perspective, I've seen huge improvements, specifically around inflammation then, which is the sort of broad topic of this conversation, although we have gone into quite a few different areas. Do you see value with time-restricted eating specifically for inflammation and immune function as well?
Oh yeah, absolutely. So in terms of inflammation, let's look at the surrogates of diabetes, hemoglobin A1C, because that is one of the manifestations of inflammation. As I mentioned, this study that recently was just published out of China looked at a number of patients that were randomized. This was a randomized controlled trial, and they tried to blind it as much as they possibly could. Obviously, the subjects knew what arm they were in, but the people assessing them were blinded as to which arm they were in. And the arm was, hey, look, eat as much as you want any time of day, and we'll see how things go. And these were diabetics. These were people who had already diagnosed diabetes. And as we know, with diabetes, there's amazing amounts of unfortunate inflammation that can cause coronary disease, that can cause heart attacks, strokes, all sorts of problems. And in the other group, the intervention group, they said, look, we're going to limit your meals to just 10 hours a day. And that actually is pretty good, because I've seen studies where they did it to 8 hours a day. But no, they did it 10 hours a day. And they specifically allowed them to eat from 8 o'clock in the morning until 6 p.m. Okay, so that's reasonable. Now again, that means that their first bit of food that they had in the morning was not before 8 o'clock in the morning, and they were basically asked to eat well before 6 o'clock so that their sort of fed state, they were done by 6 o'clock. And so you've got now from 6 o'clock in the evening all the way through to 8 o'clock the next morning, where there's no food, there's not even a snack, nothing goes into your mouth except for water and maybe a little bit of lemon juice if you wanted to have that with it, but no calories whatsoever. So what they found was astounding. They were allowed to eat as much as they wanted. They just had to eat it between these hours. And what they found was that there was a drop, a 20% drop in the hemoglobin A1C. Let me explain what the hemoglobin A1C is. It's a measure. Somebody has elevated glucose for a period of time. That glucose can bind with the hemoglobin and stay on there. And we use that in medicine to measure the average blood sugar over the last 3 to 4 months in these patients. So this was a study that went over about a 12-week period of time. So in 12 weeks, these patients, these subjects in this study, were able to drop their hemoglobin A1C by 20%. That's more than medications could do alone. That's the effect of just, we're not even saying to change your diet. They didn't say to change their diet. They didn't say to change the amount of food they were eating. They just asked them to eat it more concentrated in the day and have a longer period of time where there was no food going into the mouth. I think that's astounding.
It is incredible. And, the big thing I think as you describe that is coming full circle to the start of our conversation. It doesn't cost any money for people, does it? It's like, it's potentially saving them a bit of money because they're snacking less in the evening. But it's not necessarily, it's not only the money, it's that it's not necessarily requiring a huge lifestyle upheaval, a brand new diet. I need to learn to cook new foods. It's like saying, okay, well, hold on a minute. Maybe don't worry about that at the moment. Just keep eating what you're eating. Just change the window in which you're eating it. And I think it's got such potential, a message like that. I'm like you. I prefer the term time-restricted eating to intermittent fasting because I kind of feel intermittent fasting is a bit confusing sometimes. What does it actually mean? Whereas time-restricted eating, I think, can be very, very clear. What sort of recommendations do you make if you've started making these recommendations with your patients when it comes to time-restricted eating?
Yeah, it's really important to be able to look at their lifestyle. So for me, some weeks I'm in the intensive care unit from 7 o'clock in the morning to 7 o'clock at night. I don't get home till late. And so you don't want to be shifting this around. You want to sort of pick something and go with it. So there's really two variants of this. And here are the rules. Number one is you don't want to have your feeding anywhere close to the time that you're sleeping. That's the important thing there. And usually you want it maybe a good 3 to 4 hours before you go to bed. So eating close to the time that you go to bed is not a good idea for a number of reasons. If you eat close to the time that you go to bed, that can increase the risk of gastroesophageal reflux. It can increase the risk of aspiration and also has issues here. So the two ways is either having breakfast very early in the morning, maybe about an hour or two after you get up. And that's hard to do depending on when you get up. And then having a lunch or a very early dinner, or you flip it the other way around and say that you're going to skip breakfast, have a lunch being the first meal of the day at around 12, and then eating relatively early in the evening, early enough, like maybe around 6 or 7. So you're well within that 8 to 10 hour window, but then give you at least 3 hours before you go to bed at night. I think those are the two systems that seem to make the most sense from a practical standpoint that is going to be most common, but everybody's got to sort of figure this out for themselves and see what works for them. This is the thing. It's very personal.
Yeah, I completely agree. I think the research in this area is simply just growing by the week in terms of the potential benefits, but then it's converting that and going, okay, well, I know the kind of 8 a.m. till 6 p.m. Window worked for my friend Bob, but actually that ain't going to work for me. There's no way that's going to work with my school run, kids, job. And I kind of feel most people are able to find something that works for them in the context of their lifestyle. So it's definitely worth people experimenting. Heat, cold, how can these things help support our immune system?
Yeah, so I really looked into this because I found it just fascinating in terms of the timing and what we've done in the past. Yeah, you're absolutely right. The Finns almost religiously do this. So when they do studies in Finland on saunas, they have to say that if you use a sauna once a week, that's the control group, because everybody uses a sauna at least once a week, and they go up to 2 or 3 times. They have more saunas in Finland. They have enough saunas in Finland that everybody in Finland at once could go into a sauna, and there would be enough saunas to hold everybody. And so it's a great country to study this on. I mean, the Swedes and the Nordic countries, they use it, but not to the same degree. And I remember when the pandemic first started, looking at Finland to see whether or not they had improvement in their overall outcomes, and they were the ones that actually had the first case out of all the Nordic countries. They're the ones that had shut down just about as much as everybody else. Most of the numbers, interestingly, were coming from Helsinki, and there was a Somalian group there in the capital that was having most of the cases. And I thought that was an interesting issue because, again, there may have been a vitamin D deficiency. Again, they're used to having a certain amount of sunlight where they are living, and being in Helsinki in Finland could certainly mean that they would be at risk for vitamin D deficiency. But if you were to take the Helsinki out of the equation, they had, even if you put it into the equation, they had great numbers. It was even better if they didn't. So what's the basis of this? Again, let's go back to the 2 types of the immune system. There is the innate immune system, and there's the adaptive immune system. What we now know about SARS-CoV-2 is that the proteins in SARS-CoV-2, and indeed other viruses as well, suppress the body's innate immune system. Look, your body's immune system is so well tuned that for most viruses, you're not going to have a problem. For a virus to overtake the human body and cause an overwhelming infection, it has to have some sort of a mechanism where it cripples the innate immune system. And that is what was discovered with with the first SARS virus in 2002, and it's no different for this one in SARS-CoV-2. There's been a number of papers that have been published on this. So the problem is that with the innate immune system crippled, the body gets infected in many cells, and then 7 days later, the adaptive immune system turns on, and that's when we have the cytokine storm. So if it was possible for us to enhance the innate immune system in a way that the SARS-CoV-2 would not have free reign, not infect many cells, we might be able to stop this short. So what I'm talking about is something that we would ideally do right after someone felt sick, but well before they were so sick that they had to go to the hospital. So we're talking about early treatment. So as it turns out, there is a way of enhancing that innate immune system. And it's actually very, very simple. It's with heat. This is exactly what the human body does itself. How many times have we taken, Tylenol or paracetamol over there in the UK to suppress a fever, thinking that the fever was the problem? It's actually one of the ways that the innate immune system has of signaling to the body that there is a foreign invader and that the innate immune system has to go to work. What they have found in research is that the product of the innate immune system, which is something called interferon, which is a good thing. It's a product that's made by the human body. It's well named because it interferes with the virus. What we have found that as the body temperature goes up, the amount of interferon that is made goes up as well. In fact, when you hit about 39 degrees Celsius, there's a 10-fold increase in interferon secretion from the macrophages in the innate immune system. Now, that's really important because when we look at some of the papers that have been published with SARS-CoV-2, we're seeing, this was published in Science, it was a very prestigious journal, very elegantly done paper that showed that as interferon levels go up in patients, the severity of the illness goes down. Some of the most severe cases of SARS-CoV-2 in this cohort of studies were in patients that had very low interferon levels, either from antibodies against them or from innate inborn errors of metabolism that didn't allow the body to make enough interferon. So clearly, the amount of interferon that is secreted is going to have a huge impact on how the patient does. So that's benchtop. How do we convert that into everyday life? Well, let's go back. Let's go back in history. There was a gentleman by the name, it was an Austrian psychiatrist by the name of Wagner Joreg. Dr. Wagner Joreg was in charge of an insane asylum in Austria, and he noticed that his neurosyphilis patients at the time, this was back in the 1900s, 1920s, they got better when they had a fever. And so he had this idea that if he could only bring up their temperature, maybe this would impact the neurosyphilis. So he actually infected them with the blood of people that had malaria. So he would actually on purpose give these people malaria. Now, it was under a controlled situation, and they knew how to treat malaria. But sure enough, these high fevers that these patients had from the malaria cured the patients of their neurosyphilis, and then he simply cured the malaria, and they were fine. For this, he won the Nobel Prize in 1927. The very next year was when we discovered penicillin, which is the treatment for neurosyphilis, as well as many other things, and other antibiotics, of course, came from that. But here's the point. The point is that to do the type of work that you need to do to raise up the temperature, they used all sorts of things. They injected them with foreign proteins. But one of the most common things that they would do is they would put these patients in heat boxes or heat closets, or heat them up with hot towels so that their body temperatures would come up. They'd be sweating. They'd do this for about 20 minutes. And then they would immediately cool them down, very similar to the things that the Finns were doing in their Finnish saunas. And all of this took a lot of time. They had hospital sanitariums that were set up, and it was very labor intensive. Now they could treat it with just a pill. And so what happened was, it's not that these things didn't work. It's just that they were labor intensive. And now with the advent of penicillin and these medications, we found things that were much cheaper, less labor intensive to do. And we've gone down that road. Now, look, I'm an intensive care doctor. I give medications all the time to my patients, and I'm sure thankful that we have them. But it doesn't mean that these things that we used to do don't work. And so I think in a pandemic situation, these are things that we should at least look at and see whether or not they might work in COVID-19.
I mean, so interesting to hear that kind of that historical narrative there of all these other kinds of treatment modalities, particularly using heat. It strikes me that, as you say, huge benefit for medication in many situations, but also because we presumably got penicillin and we had this quicker, easier way to treat people, maybe we stopped studying and researching some of those other methods that actually cultures have been using for so long. If you talk to people of certain backgrounds, they'll tell you things like, oh, my mum used to tell me when I was sick to go and sit out in the sun and put more, I don't know, turmeric in my food, for example. That's not uncommon in Asian cultures. And then we get modern science showing what a powerful anti-inflammatory turmeric and curcumin is. We talk about sunlight in terms of vitamin D, but actually maybe it's also, as you say, we're trying to reduce it as to it's just one thing, but we know the sunlight or just the natural light helps us set our body's circadian rhythm. But maybe the heat is also helping the innate immune system function better. It's quite incredible, isn't it, that we're almost having to relearn what we once knew.
Yeah, when I've talked about this before, I've had people come up to me from multiple cultures. I've had people come up to me from Asia, from Iran, from South America, and they all have their flavor of how they do it, but it's essentially the same thing. In Iran, they would go into the hot sand and try to heat up that way. If it was in Asia, they did it a different way. South America, it was another way they did it, but it was all a variation on a theme, which was heating up the body briefly to cause a fever and sweat, and then a cool down. Now, the question is, what's the point of the cool down? Well, scientifically, we now understand that when you heat up the body, you want to lock in that heat, and the cold can cause vasoconstriction, locks in that heat, and also causes a lot of demargination of white cells that can then go to the lymph nodes to do what they need to do. So it's interesting. And what you were just saying made me think about this. The sunlight, the fresh air, the hydrotherapy. Looking back, I found this very interesting article published on May 1st, 1919 by a Dr. Wells Rubel. Now Dr. Wells Rubel was the medical director of the New England Sanitarium. This was in Boston. And this was a system of sanitariums that were run by the Adventist Church at the time. And you have to understand that this was after a very famous gentleman by the name of John Harvey Kellogg, who was the medical director at the Battle Creek Sanitarium, who essentially wrote the book on hydrotherapy. This was also the brother of the guy who invented Kellogg's cornflakes. There was a lot of push at the time for understanding of health concepts and things of that nature. Well, he wrote in May of 1919, with the pandemic that was going on, that this was an ample opportunity to employ what they called rational treatment. And what did rational treatment involve? Here you have this contrast, because in the United States, you had these army hospitals that were using a lot of aspirin at the time, because they felt that treating the fever was important, because that maybe the patients were dying of fever. They were keeping them in the army camps inside these closed conditions, minimal ventilation, no exposure to sunlight. And so we knew what the statistics were in the army hospitals. 20% of them came down with pneumonia, and another 40% of them died after they got pneumonia. Whereas in the sanitariums, and there was about 10 of these in the Northeast, what they did was something completely different. They isolated them. They used no medication, so they didn't use any aspirin. They did hydrotherapy, which was heating up the body, cooling them down. They went out, had them go outside, exposed to the sunlight, fresh air, all of the things that you and I were just talking about. And the amount of patients that went from initially infected with influenza to getting pneumonia was 2%, as opposed to the 20% that was going on over in the army hospitals. The very few that did develop pneumonia, about 50% of those died. So it really didn't work after you had pneumonia, which is why I believe this is more of an early treatment. But overall, the case fatality rate was 6% in the army hospitals, just over 1% in the sanitariums. And when I look at that, published over 100 years ago now, I look at that and I say, wow, if this could be something that we could easily implement without a pharmacist, without testing, without a physician in any country of the world, so long as they have a way of heating something up, applying it, and then cooling them down. And imagine what we could do in those situations where we couldn't get medical care out fast enough. I think it actually may do quite a bit of good.
It's incredibly humbling, isn't it, as a clinician, to think over 100 years ago, some really good research was being published that we have somehow forgotten about. I mean, those reductions in pneumonia rates and case fatality rates are hugely significant, especially when you're talking about them getting no sort of conventional treatment. All they're getting is this hot cold therapy. So it's really exciting. How do you see that fitting in with, the widespread adoption of cold immersion now, particularly in the sort of wellness communities? Wim Hof, who I've spoken to before on my show, Wim's obviously doing a great job at elevating, how beneficial certain types of breath work can be for our overall health and for our stress levels. He's also helping to promote awareness of, potentially for some people, how beneficial cold immersion can be. And lots of people now, through many other methods as well, are trying out various forms of hot colds. It's quite interesting, isn't it, that there's this modern, almost epidemic of cold immersion advocates now. How does that fit in a little bit with kind of this research from the past? We're also in the UK, I think there's some studies on cold water swimming and how that is helping people with depression. I don't know if you've seen any of those studies, but again, that's super interesting as well, and all fits into this whole big picture that you mentioned at the start: immune system, inflammation. We know many cases of depression are driven through inflammation, right? So help us put all that together, if you will.
Yeah, it's a lot of stuff there, but I see a recurring theme over and over again. Sometimes the most helpful remedies for the human condition are not packaged in a pill box, and they're actually packaged in nature. And not to say that there isn't a benefit from these things. I'll tell you, look, if someone comes in to the emergency room and they have a stroke, we are going to get a CAT scan. We're going to give them a thrombolytic. We're going to open up that. I mean, there's nothing in nature that I know that's going to help right at that moment. So what I'm starting to find, if we want to put all of this together, is things that are emergent, things that are urgent, things that are in a pandemic. There are things that sometimes we have to use. Emergency measures require emergency situations require emergency measures. But if we are looking at trying to get toward a healthier existence, I don't think the answer there is going to be in medications necessarily. I think the answer there is going to be in lifestyle and in healthy living. And I think the answers to those things have been around for many years. That's what I'm getting the sense of. Now, of course, there's exceptions on both sides. But again, I'm an advocate of the Swiss cheese model. If it works, add it to the Swiss cheese.
Have you ever heard of the phrase that James Nestor shared with me when he came on my show? I don't know who said it originally. I think he heard it from a friend of mine called Brian McKenzie. And I'm interested as your take on this, given that you are an intensive care physician, but you also seem to have this really, amazing passion for lifestyle and nature and what we can do for our prevention as well. The quote is, I think that Western medicine helps us not to die. Eastern medicine teaches us how to live. And I wonder what your perspective might be on that, given what you've been talking about so far.
Yeah, I think that's a reasonable thing. I would hate to say that the things that are ascribed to Eastern medicine is only in Eastern medicine, because I think, as we've talked about before, a lot of those things were originally all over the world, but I think particularly in the West, we've lost it and ceded it to the Eastern cultures. But I think it was there to begin with, and it still can be. But that's a very good point. We there's another expression that we hear. You may not have heard this. It's more of an American expression that in America, death is optional. So we always have something that we can do to keep you living, right? So maybe not maybe with a high quality of life, but it seems to be this binary, alive or dead, and that's that. But that's not what we ought to be interested in. We want to be interested in living fuller lives and enjoying life, and that's something really worthwhile attaining.
As someone who does work in intensive care, that idea that death is optional is super interesting. Do you, or have you found that you've had to really ask yourself questions about this in your work as a doctor, where presumably you can keep people alive sometimes, where there may be a case that actually, is this the best thing for this patient? Is that something you've had to wrestle with as a practicing MD?
Oh yes, I can tell you, because I have cultural connections with the UK. As I mentioned, my mom is a nurse that trained in Birmingham. I have on my wife's side, who's Polish. She's got family members there in Poland. It's very different here in the United States. There is no age limit to what we can do or what we will do. And there's something about the American culture that means that, we never give up. We keep going, no matter what it is. That culture is changing. People are starting to accept that a little bit more, that, we have to look at quality of life. And I oftentimes will have patients that have absolutely no quality of life, and we'll be asking families, do we need to put, instead of them being on the ventilator, we'll switch them over to a tracheostomy, which allows them to be on a ventilator in a warehouse, essentially in an institution, to see if they'll get better. Now, oftentimes it's a reasonable thing to do because they need to rehabilitation, but other times it's just for the fact that we don't want them to die. We just want them to stay alive. And we oftentimes have discussions with families and try to explain these sorts of things. But it is definitely an area that we spend a lot of time talking to families about and educating them. And I think as a society, America is coming around to understanding some of those issues, that it's not, staying alive is good and dying is bad. The question is more nuanced than that.
Do you feel that being an intensive care doctor has made you more passionate about prevention and the things that we can do in the first place to prevent ourselves ending up there in the first place? Or have you always had this passion, or do you feel that passion has developed as you've gone throughout your career?
Yeah, that's a very good question. And I'll tell you, I did not come around to thinking about prevention as much as I should have until coronavirus came around. And then I had to really start thinking, look, here's a pandemic. People are going to die. We don't have things that we can do to stop it that we know of. We don't have randomized controlled trials that have been done and published in big journals like The Lancet. But let's now start looking at things that we can do to improve our lifestyle so that we can withstand this wave that is coming. And that has really driven me, because I've had to look at these things to be able to dissect them and find out what it is that works. But now that you mentioned that, when I go back to the ICU, yes, a lot of the diseases that I see in the intensive care unit are the result of abuses that have happened over years and years and years. Whether it's smoking, whether it is drug use, whether it is alcohol, all of these sort of abuses that have occurred cause these patients to show up. And in the United States, we have, and I'm sure you do as well, have rules against, they have rules for keeping things private and not talking about patients and names and things of that nature. But I would really love if we could somehow do this, have the public come in and see the type of things that happen with some of this living and see the results at the end, so they know where this is leading to. I think that would be very educational, because people don't see it and we can't talk about it.
Yeah. One of my best friends, a chap called Karen, he works in a place called Chamonix in France at the foot of Mont Blanc, and he's an acute care physician. He works in the ER there. He works in intensive care there. And a few years ago, when I was in Chamonix on holiday, I remember saying to him, hey, because he knows what I do and that I'm all for promoting healthy lifestyles as much as possible with as many people as possible. And I said to him many years ago, hey, mate, I guess it's not as relevant for you because you're seeing people who really do need acute medicine and the best that we've got. And he said, no, mate, not at all. It's even more relevant for me. I'm often sitting there in A&E talking about the stuff that you're talking about that they can do for their mood or their lifestyle. It is just as relevant. So it's fascinating for me to hear that from my friend, but also from you in a completely different country, a different healthcare setting. Yeah. Your experience as an acute physician is helping you, or reminding you and all of us just how important paying attention to our lifestyle is.
Yeah, it's so sad, the things that we see on a daily basis. Yeah.
Now, one of the things that people often say about looking after ourselves is that it's expensive and it's not relevant. It's not accessible to all socioeconomic groups in society. Yeah. And if we talk this through about what we've spoken about so far, vitamin D supplementation is very cheap, super cheap. Improving our sleep, there's lots of things we can do that are free. Now, I appreciate there can be a lot of stress in low socioeconomic groups, which can make it harder for sure. I don't want to sort of pretend that that's not going on. But again, there's a lot of simple things that we can do, like looking at natural light when you wake up, not looking at screens in the evening, caffeine consumption, having it in the morning, etc., etc. That is accessible to people. Where do we go from that? We mentioned NAC, food. There is a debate on whether it's cheap enough to eat healthily. And I mean, that's another topic, but I think there's good evidence to support that actually many of these foods are affordable for many people. If we use that to hot-cold therapy, because I want to make sure, I really believe that good health is accessible to everyone, or it should be. And I feel as physicians, we really should, as much as possible, be making sure it's accessible to as many people as possible. Not everyone has access to a sauna. Not everyone can afford the gym membership to have a sauna. They can't afford to have one in their home. They don't have the space. So how does that hot-cold therapy apply itself to all of us?
Yeah. So first of all, before I forget, there are some great websites that I didn't create, but I know that are out there that can talk more about this for your audience. So the first one is Hydro, the number 4, COVID.com. So hydroforcovid.com. And that one's actually was created by a physiotherapist in Australia that really studied the protocols of John Harvey Kellogg and what he did at the turn of the century. And then there's another one that's even more practical than that called hydrotherapyathome.com, all one word. And that has a number of videos on there and also just really how to do it yourself. And what it shows in those videos is how easy this is. So literally, you can have a pot of boiling water, you can have a microwave. You've got to be very careful not to burn yourself in these things. But basically heating up a wet towel and applying it on the body with a dry towel in between so you don't burn yourself, both on your back and your front. And you basically cover yourself up in a towel to keep the heat in for about 20 minutes until you have you're sweating on your lip or your forehead. That means that basically your body temperature is going up and your body's trying to cool itself down, but you're not going to allow it to do that. Putting your feet in a hot foot bath, all of these things are ways of increasing the body temperature and have been used for decades, for probably hundreds of years to do this. And then after about 20 minutes of this, taking it all off and then applying a very cold, wet towel over the chest and applying kind of a friction to stimulate and to cause vasoconstriction of the blood vessels and allow the demargination of the white blood cells. These are things that I didn't make up, but I'm learning about it. There's a number of institutes here in the United States that are actually doing this on patients. One of them is called the Weimar Institute here in Northern California by Sacramento. They have a number of people that have been doing this for years. There's been a number of schools that used to teach this. They stopped teaching it back in the 70s because they thought it was useless because who's going to do this, right? It's very labor intensive. But there are a few people that know still how to do this, and it's a sort of a growing art. There's been a lot more interest, obviously, because of coronavirus. But if you go to those two websites, they will show you how to do it. But you're absolutely right. This is something that can be done very easily in a situation where you don't need to have a lot of money. In fact, the gentleman who did the website Hydro for COVID was a consultant when there was an outbreak in Laos, actually, where they were showing them how to do these in refugee camps. And they could use black plastic bags and sit out in the sun and sort of heat up with trash bags and then cool off. So there's different ways of heating up the body, getting that temperature up and then cooling down. So it's very inexpensive.
How do you do it yourself, if you do at all? Sorry to interrupt. If you're enjoying this conversation, there's loads more like it on my channel. Please do press subscribe and hit that bell. Now, back to the conversation.
I do. So if I want to, just as a tonic, want to make sure that I'm supporting my immune system, I actually have a spa that I've wired up to 104 degrees Fahrenheit, and we measure it in Fahrenheit here in the United States. In the United States, it's a law that you can't have a sauna or a spa or a jacuzzi go up to more than 104 degrees. So that's how I do it. But if I'm really serious about it and I really want to do it right, then I will spread a mat out. My wife will help me. We boil up some towels, put it down on the towels, lay on it, and then she'll put the towel over me. I'll put my feet in a hot foot bath that's really, really hot, but not burning. And you'll do that for 20 minutes. And I'll tell you, boy, you start to sweat all over your body. So you have to be well hydrated. And after about 20 minutes, she'll put that cold on. And it's interesting because you feel so hot that you would think that cold is something that you don't want to have, but you're actually waiting for that. It's so hot. And then after about a minute or so of that, you go have a shower, you lay down in your bed, you feel exhausted, but boy, I've done this in a couple of patients with COVID-19 that have called me and I've explained to them what to do and how to do it. And the symptoms, at least in those, and this is not a study, this is anecdotal, the symptoms abated very quickly after about a couple of days.
So that's in the early phase when people have just got sick, as opposed to in the late stage you were talking about earlier.
Exactly. So you don't want to wait for a test. I mean, if you're feeling bad, if you're feeling like you have a muscle ache, you don't know if it's COVID-19 or not. But it doesn't matter because this is going to help the innate immune system, which has to do its job anyway. So you don't need it. The beauty is you don't need a test. You don't need a doctor. You don't need a pharmacist to initiate this. Now, I'm not saying you shouldn't get those. What I'm saying is this is something that you can do in conjunction with all of the other medical infrastructure part.
What about hot and cold showers? Is that a simpler way and an easy way for people to try and, activate some of these mechanisms that you've been talking about so far?
Yes, absolutely. These are known as contrast showers, the contrast being the hot and the cold. And the people that are the experts on this that I have learned from have come up with a formula that they believe will work. And it's 5 minutes hot and then 1 minute cold, and then 3 minutes hot and then 1 minute cold, and then 3 minutes hot and then again 1 minute cold, and then you're done. So if you add all that up, it's about 19 minutes or so, if I do my math correctly. But this is more of a tonic. So this is something to keep your immune system up and running and making sure that it's surveying. If you start to come down with symptoms, I would probably recommend not doing the contrast showers, but doing something a little bit more aggressive, like what we had just talked about.
Yeah. Do we know what temperature we need to get up to on those hot, cold showers? Did they specify at all, or is it just hot and cold? Because of course, cold at different parts of the year. In the height of the summer in the UK, if we're having a good spell of weather, hey, a cold shower is pretty easy. It's like, I'm having a cold shower, but you try that in January, it's a very different experience of a cold shower.
Yeah, so they do actually specify, and I'm remembering the numbers exactly, but in Fahrenheit, you want the hot as you can tolerate it. And you really want the cold like down into the 60s or 50s.
Wow.
That's kind of where you want it, which is pretty cold.
When we're looking at inflammation, how does stress fit into that? What does the science tell us?
Oh, the connection is very tight, unfortunately. So stress, as we mentioned, or inflammation, as we mentioned, is this kind of this smoke or this fire or this construction that has to happen, whether or not, has to happen in our bodies to make sure that we're doing the processes that we're doing, but we don't want it for longer than that. If we look at stress and see its effects with inflammation, it becomes very apparent very quickly. So there's a number of researchers, to give you an example here, in Pittsburgh, that looked at stress and inflammation and the immunity specifically, how this affects immunity, because I think that's a big thing as well. We all know about cortisol. Cortisol is a hormone in the body that gets released during stressful situations. It's a stress hormone. And I want to make sure that I'm using the word stress here appropriately. There is stress that we feel mentally, and there is stress that's going on in the body. And I want to make sure that when we talk about stress, we're talking about that specifically. So when there is stress in the body physically, there is that stress hormone, cortisol, which is released from the adrenal gland. And one of the physiological downstream effects of cortisol, they found, was a way that it shifts the number of white blood cells. There's different types of white blood cells. Not to get too technical, there are white blood cells called neutrophils, and there are white blood cells called lymphocytes. And the ratio of these two, to give you an example, changes when cortisol levels go up. There's supposed to be more neutrophils when cortisol levels go up. And this is a natural response that is mediated through the cortisol receptor. So cortisol hits the receptor. This receptor then causes this downstream effect of neutrophils going up and lymphocytes going down. What they found, these researchers, was that when this happened, if the subject was under a lot of mental stress, so stress from every day, stress from a wedding, a divorce, a loss of a job, a gain of a job, it doesn't matter, any kind of stress, that they no longer saw neutrophils going up and lymphocytes going down. There was a completely blunted response. And what they determined is that the receptor was no longer transmitting the signal of that cortisol binding to it. In other words, this was known as cortisol receptor resistance. This receptor resistance was the result of stress. And not only were there effects from stress in that situation, but there was also issues in terms of infection. So what they did was they took these subjects that had a blunted response, and then they subjected them to rhinovirus, which is basically a common virus that causes the common cold. And what they found was that cold symptoms appeared more commonly in those patients that had this blunted response. In other words, this cortisol receptor resistance. So here is direct evidence that people, something that we know all the time, we know this innately. We know that if you're under stress, you're more likely to get infected, but we can actually see now the results of where cortisol is supposed to have a downstream effect. This downstream effect is gotten rid of, and it's exactly in these patients who have stress that gets rid of this downstream effect because of receptor resistance that causes these people to have more symptoms of the rhinovirus infection. So here's an example where inflammation, stress, immunity all sort of come together and cause this kind of interaction.
Yeah, it's super fascinating. And I guess for many people, they are becoming more and more familiar with this idea of insulin resistance, that this hormone that does many things, including keeping your blood sugar stable. If we insult the body, year after year with highly processed foods, pro-inflammatory foods, all kinds of things, then actually the body becomes resistant to that hormone. But the way you just described that study is it's sort of saying it's the same thing for stress. We can become resistant to stress hormone, or the receptor. It just doesn't work as well. So if we're exposing ourselves to too much stress, then the response in the body starts to get blunted. And I think that's something that's not commonly known, because many of us think we can get away with pushing it every single day, every single week, month after month. But you're showing with just that one study, and I know there are many others, that it has a direct response on your immune system, a direct response on how inflamed you are. So managing stress is clearly another key strategy at trying to keep our inflammation levels down.
Exactly. And let me just add to that, because we think of it in terms of infections, things from coming from the outside to infect our bodies, and how to fight those things from the outside. There are other things that our immune system has to deal with on a daily basis. It has to deal with basically the garbage that our cells make. In fact, cells become damaged, and those cells that become damaged have to be dealt with. And if they're not dealt with, these damaged cells accumulate, and our body starts to look like a trash dump. If our immune system is not taking away the trash, taking away the dead cells so that new cells can replace it, we have a problem there as well. So imagine somebody with chronic stress. Imagine someone who's not allowing their immune system to do the things that it needs to do. Our body's cells, instead of being brand new, ready to go off the assembly line, we're dealing with last year's version 1.0, because our immune system hasn't dealt with these damaged cells. And so this is something that goes on all the time in our body. And our body sets certain times. We'll talk more about this when we talk about time-restricted feeding. There are certain times that are scheduled in our body for these processes to occur. Their body sets aside time based on these clocks that are in every cell, that is run by the suprachiasmatic nucleus, that says, okay, we're awake, we're doing stuff. This is not the time to put out the trash. This is not the time to have janitorial coming in after business hours. We need to work, 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 work. But then when the time comes to allow janitorial to come in, to allow our immune system to go in and see what needs to be taken down and broken down so that new things can take their place, if we're not allowing that to happen, why would we believe that those things are going to go away on their own? They don't. And we need to have that time to be able to do that.
What about a different kind of stress? Fear. Fear itself is not necessarily a helpful thing for your immune system to work well. So, are you familiar with any research on fear and how that plays into our immune system?
Oh, yeah. I'm reminded of a really interesting study that was done by Jennifer Heiss at the McMaster University, where she took students that were in the last 6 weeks of their term. And boy, if you want to if you want to incite fear, think about this. Here you're a college student. You're at the end of the term, 6 weeks to go. You have your major exams. Your career is based on getting a good grade in college, and your good grade in college is based on doing well. There's fear there. There is anxiety. There's no question about it. And what they did was they randomized these students at McMaster University to three different groups. There was one group where they did nothing. It was just, do whatever you want to do and study for your exams. And the second group was a low intensity exercise or moderate intensity exercise group where they exercised 3 times a week. And they got their heart rate up to about 75% of their maximum predicted heart rate. For those that don't know, your maximum predicted heart rate is 220 minus your age. And so if you take that number, multiply it by 0.75, that's kind of where they would get their heart rates up to. And they did it for about 20 minutes a day, 3 times a week for 6 weeks, the last 6 weeks of the term. And then in the third group, they did the same thing as they did in the first group, the second group, moderate exercise, except instead of moderate exercise, they did high intensity exercise, still 20 minutes a day, still 3 times a week, except they got their heart rates almost close to about 100% of their heart rate. So very intense exercise. And then what they did was they looked at depression scores. So the Beck Inventory Depression Score 2, which is a very well validated inventory depression score. And they also looked at cytokines. So they looked at IL-6, they looked at tumor necrosis factor alpha, and they measured these in these 3 groups. So what do you think happened? The first thing that was really interesting to me in this study was when they looked at the control group. The control group went from about, there was a change of about 6 points in the Beck Inventory Depression Scale Score. What does that tell you? That tells you that after 6 weeks of immersing yourself in a stressful situation where your career, where your livelihood is dependent on a score, you can quickly become depressed in that kind of a situation, just in 6 weeks. Now we're headed into our second year of this pandemic. And so it should be no surprise to people that all of the things just the coronavirus itself, family members, also what's going on with at the government level, internationally, politics, all of this sort of stuff, that we're going to have some major issues with depression as a result of fear and anxiety. There's a well-established connection between fear, anxiety, leading to depression. And we saw that very clearly in this study. In terms of in this control group, there was also increases in tumor necrosis factor. And there was also a drop in IL-6, which is one of the cytokines that's involved with fighting infections. But let's look at the other 2 groups, moderate intensity and severe intensity or a high intensity exercise. Which one of those 2 do you believe did better in terms of mitigating the effects of fear and anxiety? Well, it was the moderate intensity group. The moderate intensity group not only did not have an increase in depression, they actually had a reduction in depression, actually went in the other direction. In other words, in the moderate intensity exercise group, actually also in the high intensity exercise group, they had a reduction in their Beck Depression Inventory Scale Score. So what do we learn? We learn that exercise is really important in situations where you have chronic fear and anxiety. It can do a tremendous amount in terms of your mental well-being and also your physical well-being. But in terms of anxiety and perceived stress, so when you asked the subject, do you feel like you're under stress? The moderate intensity exercise group actually did better than the high intensity exercise group. And that was actually the same for the cytokines. The reduction in tumor necrosis factor alpha was greatest in the moderate intensity exercise group. And what Jennifer Heiss showed here in this study is something that we have known for years in the high athlete population. So the elite athlete population, the population of athletes that go to the Olympics, we've known this for a very long time. And that is this, that people with high intensity exercise have actually higher levels of stress, have higher levels of inflammation, have higher levels of stress hormones than those in the low and moderate intensity groups. And so as a result of this, there has been a number of papers, of research that has been published on how to mitigate the infection risks in these high intensity athletes. Think about this. This is not political. This is not, there's no agenda here. The only agenda is that these governments want to send their athletes to the Olympics to win the gold medal. And when, a 100th of a second can make the difference between a gold medal and not even getting on the podium, they're going to stick with the science. And what the science says is that you've got to make sure that everything is well timed, everything is well versed. You have to make sure that you have time for rest. And we could go over the studies and the recommendations, but many papers have looked at this very stressful group, these high intensity athletes. And what you'll see is the recommendations there are the same recommendations that we've given so far on this podcast in terms of sleep, in terms of making sure that we avoid infections, in terms of making sure that we're getting enough nutrition, diet, all of these sorts of things. But the point here that I want to make about getting back to your first question, which is about fear and anxiety, is one of the major prescriptions that I would advocate for everybody at this point is to get out and to exercise. There's this J hook, this J curve, I should say, approach, whereas we're all, if you can imagine the letter J, okay, and we're at the very beginning of that letter J, we're all couch potatoes sitting on our couch, watching television, watching the news channels talk about how everything is going downhill. That's not a good place to be. As soon as you get off the couch and start exercising and start doing something 20 minutes a day, 3 times a week, you're going to go down. The J goes down. Okay. And as a result of that, your inflammation goes down, your well-being improves, your Beck inventory depression scale scores start to improve. As it reaches a certain point, though, that if you start to do more intense exercise, you could actually get some reversal of that improvement where it goes back up and even higher, as you would see in these high intensity groups. Rangan, this explains why sometimes we hear about people being in the hospital from COVID, and we say, well, they were a marathon runner. Yeah. I mean, these, marathon runners, yes, these are the people that are actually at most risk. Why? Because they have chronic inflammation going on in their body because they are exerting themselves so much. So the key here is, what is a good recipe for fear and anxiety, among other things? Number one, moderate exercise. Don't feel like you've got this huge barrier that you've got to overcome and be like these elite athletes that you see on television. No, just getting up off the couch and having a regular routine is so important.
Thank you for sharing all that, because I think it's such a key point, isn't it? When we talk about movement and physical activity for health, it's like, well, how much do I need to run a marathon? Do I need to be hitting the gym high intensity, for 1 hour sessions 5 times a week? No, the research that you're sharing is saying that actually you don't have to do that. You just need to get up, move, go for a brisk walk, maybe 20, 30 minutes 3 times a week. You can get a lot of the benefits from doing that. So I hope that is really empowering for people who may feel that they don't have time, money, inclination to go, and really push it. And I guess that really speaks to one of the wider problems we have now in terms of health messaging is, for all the benefits social media does have in terms of sharing health information, sometimes we can feel as though we're not doing enough, or that, a 20-minute walk 3 times a week is not enough because this influencer is killing it for an hour every single day, right? So I think that really puts a bit of perspective for people. It really gives some encouragement. And I don't know how you found this, Roger. One thing I've always tried to do with my patients is help them understand what is the right dose of exercise for them to help them with their physical health, their mental health, reducing stress, reducing anxiety in the context of their lifestyle? Are they killing it at work? They're not getting enough sleep every night, yet they're still trying to push it really hard in the gym. Or, because often I say, well, look, maybe you're much better off with yoga 2 or 3 times a week to help you balance all that excess stress that's in your life. Whereas someone else may be okay pushing it a bit harder because they don't have, let's say, a hugely stressful life, or they have time to get 8 hours of sleep a night. So it is quite nuanced, isn't it, really, when it comes down to each individual?
It is. And I can tell you, being a physician, I see people all the time that simply just can't walk for 20 minutes a day, either because they have joint problems, knee problems, or things of that nature. There are ways of getting around that. So if you can't walk, how about a stationary bicycle? You don't have to worry about balance. You don't have to worry about falling over. You get on the stationary bicycle if you can have access to one. A lot of places have access to gyms if you can do this, and you can simply put your feet on those pedals and turn them for 20 minutes. Obviously, if you have a heart condition, you want to make sure that you get cleared by your physician first before you do that. But there are a lot of things you can do.
Nature itself can be good for our immune system for multiple reasons. And I wonder whether you could speak to some of the benefits there are for our immune health when we get out in nature.
Yeah, absolutely. So there was a study that was done a number of years ago by some oncologists that were looking at a way to support their patient's immune system while they were getting chemotherapy. Chemotherapy, as you know, kills cells, the rapidly dividing cells of cancer, but unfortunately, it also makes an impact on the immune system. So what they decided to do was add something called eucalyptus oil, so the oil of the eucalyptus tree, to an in vitro study, and it showed that the eucalyptus oil stimulated the innate immune system in terms of phagocytosis, that's eating bad things up, just as much as something called lipopolysaccharide. For those of you who don't know, lipopolysaccharide is a component of the cell wall, if you will, of gram-negative bacteria. So in other words, bacteria activate the immune system. Eucalyptus oil does it to the same degree. And it actually makes sense. If you look back again at the pandemic of 1918, eucalyptus was used extensively. People knew that eucalyptus was a great antiseptic, immune booster. In fact, even today, it's one of the active ingredients in Vicks VapoRub that your mom probably rubbed on your neck when you were yeah. So in fact, if you smell eucalyptus oil, you'll say, "Oh, this is Vicks." Eucalyptus oil, and that's just one of the aromatic compounds from one of the trees. So there was a study that was done in Japan where they took these really well-to-do executives from a Japanese company, and they took them up into the Japanese forest where the Hinoki cypress tree was indigenous, and they had them walk around for a couple of days in the woods, and they measured what they call phytosides. Phytosides are these aromatic compounds that are given off by the trees. And they measured the innate immune system, the cells associated with the granules in the innate immune system, chromogranin A, chromogranin B, all of these things that go out and fight and are basically surrogate markers of the immune system. And what they found was that there was a definite elevation in all of those things when they went out into nature and they were exposed to these phytosides. So you say, well, okay, well, what was it? Was it the fact that they left work? Was it the fact that they went up to altitude? We don't know what it was. Well, they knew that. So what they did was they took them now and they went back down to Tokyo. They put them in a hotel and they infused in the room the Hinoki cypress oil, okay? And they found the exact same effects as they did when they were up in the forest. But there was one exception. And the one exception was when they measured the cortisol levels in the urine. Now, you and I know that cortisol levels are a surrogate for stress. What they found was the cortisol levels in the hotel room were higher than the urine cortisol levels when they were up in the forest, which means that they were not only getting the benefit of these phytosides, which, by the way, lasted for about 7 days. not only were they getting the benefit of that, but they were also getting the benefit of reduction in stress overall as measured by cortisol levels. So there is a benefit in getting out into nature in terms of relaxation, but there's also an added benefit, and it doesn't have to be Hinoki cypress trees. It could be the fir, the pine. They all give off these phytosides that are natural compounds that seem to affect us in a way that it boosts our immune system.
Yeah. I mean, it's incredible. I remember reading some of those studies a few years back, and I think in one of them that you mentioned, I think they even showed that the body's natural killer cells, of course, are a very important part of our body's innate immune system that helps us, eat up viruses, for example. That went up significantly, I think, in that study, if my memory serves me correctly. And I love the fact that in Japan, they've got this term for it, forest bathing. It's this cultural thing that they do. And I guess in terms of trying to make practical recommendations, you're saying that actually those benefits lasted for about 7 days. So could we extend that and say to people listening, to families listening, say, hey, look, maybe there could be, maybe we can't say this for sure, but incredible benefit from a long hike in nature once a week. Do that as a family. It's going to help bond you together. It's going to help lower stress, but you may also be boosting your innate immune system, and maybe that will last till the following weekend. I mean, is that a sensible recommendation, would you say?
Oh, you are taking the words right out of my mouth. This is exactly where I want to go with this, because this is the next level. You know what fractals are, right? The fractal is a pattern, and then there's a pattern within a pattern. And this is the next pattern up when we're talking about sleep in the 24-hour pattern, because now we're going to the weekly pattern. And science has shown very, very clearly that there is a 7-day cycle to the human body. And if you think about it, this is quite remarkable, because if you look at the patterns that we have in society, right, we know that a year is related to how long it takes for the Earth to go around the sun. We know that a month is the time it takes for the moon to go around the Earth. We know that a day is the time it takes for the Earth to rotate around its axis. What we don't have is some sort of a astronomical way of understanding why do we seem to be attracted to a 7-day period. And yet every culture on the planet works on a 7-day period. I mean, in the French Revolution, they tried to go to 10 days. It just didn't work. They had to go back to 7 days. And in fact, when we look at the human body and we look at the natural cycles in the body, we know that there, of course, is a circadian rhythm, but there's also a 7-day rhythm in the human body, as we've just pointed out here with this study, but there's other ones that are related to 7 days as well. And it seems as though we need to have a day off. I remember I was watching actually one of your videos where you were talking about the fact that we just keep getting inundated by social media, by pages, by phone, 24 hours a day, 7 days a week, it seems. And that we sometimes need a time period to just shut down, where we don't have that. We have this period of time for self, reflection, I think was the words that you use. And I totally agree with that. I think that's one of the missing parts that I think is really important.
Yeah, I didn't know all of that about 7-day cycles. That's super interesting. I certainly didn't know that in the French Revolution, they try to go to 10 days. It's really interesting. And I guess it speaks to this, the sort of wider connection that we as individual humans have to our heritage, but also, I guess, the planets, the moon, the sun, the sort of things we often don't talk about in medicine. A lot of people are scared of getting ill, especially coming into autumn and winter, of getting, taken down by viruses. And so I guess, are there specific things we can do to support our immune system to help reduce the likelihood of coming down with viruses? So I guess vitamin D, I know you've done a lot of work on this, might be a really good place to start, because it's something really practical that we can each do for ourselves, can't we?
Right. So before we get into any specifics of vitamin D, let me tell you what my philosophy is, and it's called the Swiss cheese model. So before anyone gets started on that, sometimes when you talk about one aspect of what you can do to prevent, people will get this assumption that you don't need to do anything else. And I am certainly not in that camp. I'm definitely a Swiss cheese model. So what is a Swiss cheese model? So anytime you cut a piece of cheese, of Swiss cheese, and you look at the different pieces, you'll see that the holes are in different parts of the cheese. And if you were to imagine like bullets flying at you, and the Swiss cheese could protect you somehow from those bullets, except for where the holes are. If you just put one layer of Swiss cheese on, you're going to miss. There's going to be bullets that go through. And the more layers you put on, the better protected you are. So I am definitely in all of the above type thing. So I don't want to get anyone misunderstanding that just because we're talking about vitamin D, that's all you have to do and you don't have to do anything else. As we'll talk about, the more layers of protection you have, the better off you're going to be. So let's talk about vitamin D. I mean, if anybody in the world has led the science on vitamin D, it's got to be the British. It was in the British Medical Journal a couple of years ago that there was a huge meta-analysis that was published looking at 25 randomized controlled trials that showed that faithful daily or weekly supplementation with vitamin D reduced the incidence of acute chest infections. There's a study group called TILDA, which is looking in Ireland, and they're showing a 50% reduction in acute chest infections. And this was all before COVID-19. So what's going on with vitamin D? Okay, so anyone above the 35th parallel, and that for those of you living in the United States, that's the southern border of Tennessee. That's pretty low. That's got to be somewhere in Spain. Anyone living above that 35th parallel isn't going to get enough sunlight in the winter season to keep up your vitamin D levels. And so supplementation with vitamin D is going to be a good idea. If you look see when the viruses come in, when the flu virus comes in, when coronaviruses, non-COVID-19 coronaviruses come in, and respiratory syncytial virus, they have this seasonal effect where in the wintertime, we have them up in the northern hemisphere, and then in the southern hemisphere, we see them in July. And so why is that? Well, there's a number of reasons why that could be. There's humidity. There's a number of factors, but we believe that sunlight and direct sunlight with ultraviolet B radiation to the sun produces the vitamin D that we need to be able to modulate our immune systems. So if you look at vitamin D itself, just Google vitamin D, you'll see that the structure of vitamin D looks very similar to steroid hormones like cortisol, like aldosterone, like testosterone. These substances are shaped this way because they can go directly into the nucleus and actually cause transcription of DNA into its effector proteins and change the way cells behave. Now, this is really important when we talk about, for instance, COVID-19, because in COVID-19, there is two parts of your immune system that you've got to understand. The first part of your immune system is the innate immune system. It starts off early. It's the thing that's responsible for taking care of the virus in the first 7 days of an infection. It goes around looking for things that are generally not supposed to be there and eats them up. So macrophages, natural killer cells, all of these things are the innate immune system. It's very strong when you're young. It gets weaker as you get older.
To make sure you're taking action after watching this video, I've created a free guide to help you build healthy habits. We can all make short-term change, but can those changes become a fundamental part of our life? Often they don't. And that's why in this free guide, I share with you the 6 crucial steps you need to take. They're really, really effective. If you want to get hold of that free guide right now, all you have to do is click the link in the description box below.
Now, the second part of your immune system is the adaptive immune system. This is the part that is really causing a lot of the problems later on in COVID, when after 7 days, all of a sudden the adaptive immune system wakes up. And this is the part that has antibodies, T cells that attack cells where the virus is there. And because the virus has gotten into so many cells, particularly in the lungs, when the adaptive immune system comes online, it starts to attack the lungs. And that's what gets people into the hospital, because the lungs become inflamed. They can't diffuse oxygen into the body. And it's this mismodulation of the immune system, some people believe, is the reason why people are having problems with COVID-19. And vitamin D is right in the center of that.
Yeah, vitamin D is something that I guess we've known for years. helps support our immune system health. And I really like what you said about this Swiss cheese model. I very much have that approach as well as a medical doctor, that you know, the nature of science means that we look at one thing in the trial, right? We look at, does this one thing make a difference?
Right.
But then when you translate that to a patient, you think, well, there's multiple trials showing that, you know, as we'll talk about today, vitamin D, sleep, stress, these all in isolation have been shown to help support the immune system. So kind of, why do we have to choose one instead of another? Why don't we do all of them? I really appreciate you sharing that Swiss cheese model, because I think it's something that we need more of in medicine, if I'm honest, particularly at the moment where, you know, you are on the front lines, you're seeing patients with a relatively new set of symptoms. I guess you have to take a common sense approach. You can't wait for all the kind of data to be there as you might want. You have to actually go, well, it seems reasonable that vitamin D would help support this patient's immune system.
Yeah, exactly. And what's there to lose? I mean, vitamin D is probably the most tolerable fat soluble vitamin there is. There's very good studies that show that, I mean, out of thousands and thousands of patients, the risk of overdosing on vitamin D is pretty low. And so when a patient comes in, what's the risk, right? So that's what we do. We treat people, we make sure that they're vitamin D sufficient, and we go from there. The risks are really low and the benefits potentially are high. And I know there's a big debate, not only in the United States, but also there in the UK and around the world about, you know, what is the threshold for use of vitamin D? If we don't have direct randomized controlled evidence, but we have some case control study data and epidemiological data that's pretty compelling, what's the risk really of treating with vitamin D? And I tend to agree. I mean, we're trying to save lives. So,
yeah, I mean, when it comes to vitamin D, you know, I'm very passionate about it because when my son was 6 months old, he was super sick. He had a hypocalcemic convulsion when we were on holiday in France, and that was secondary to vitamin D deficiency. So he had, you know, for many months, probably super low vitamin D. That then led to his serum calcium dropping, which led to a convulsion and us being, you know, super, super scared that we might lose him. So that was really when I saw in a very extreme, acute situation just how important this vitamin is. But since then, I've, you know, for 10, 11 years, I've been diving into the research, and you can see associations, at least, between low vitamin D and all kinds of different conditions. So I personally have a very low threshold to recommend vitamin D to my patients, because as you say, I see the benefits potentially are profound and the risks are very, very low.
yeah, exactly. The one risk though that we do is those people that don't see the Swiss cheese model. So if they think that just because they're supplementing with vitamin D, they're going to be perfectly healthy, remember that each slice of that Swiss cheese has holes in it. And so it's not where you stop. It's where you start, but it's not where you stop.
What if we just think about vitamin D then, for people listening or people watching and think, okay, I get it, it's going to help me support my immune system. Do you have any specific dosing recommendations? I think it's important to talk about, but also I know you're so good at articulating science in a very understandable way. I wonder if you would mind explaining, you know, how we typically would get vitamin D from sunlight, what would happen when it hits the skin, because I think that's really interesting for people to understand the sort of evolutionary context here.
Yeah, so there's different types of ultraviolet radiation. There's ultraviolet A and B, and A unfortunately can get through just about anything, glass as well, for the most part, and it causes all the sun damage that we don't like. Ultraviolet B, though, is really what we need to convert the cholesterol-based substances in our skin into vitamin D. So the base product is already there. It just needs to be converted using ultraviolet B. That unfortunately cannot penetrate through glass. So you really have to be outside with your skin exposed to the sun. And this happens very, very deep in the skin. And so it's so deep, in fact, that people with darker skin with the melanin in it will actually block that ultraviolet B to some degree. So what does that mean? People who are older are at higher risk for vitamin D deficiency because they don't convert that as efficiently. People who are darker skinned living at higher latitudes are going to be more at risk for having vitamin D deficiency. And so that's important to understand. So in terms of the basic science, you're getting a cholesterol derivative that your body makes and you're converting it into vitamin D. So that's the base product. Now what happens is the liver and the kidney modify it into its active form, and then it's ready to do its job going into the cells. And we see vitamin D receptors in not only in bone metabolism, but also in the white blood cells that are especially important in fighting off infections like COVID-19. Now, in terms of dosing, the people that are most at risk for vitamin D deficiency, like we just talked about, the endocrinological societies recommend no more than 4,000 units, international units per day for supplementation. Now, I've seen people personally that have gone up to 10,000 units a day, and they've had their levels checked, and they were still within a reasonable range that we weren't concerned about toxicity. You can get 50,000 units tablets over the counter, and I wouldn't recommend going up that high. But so in terms of what's the highest dose, I would say around 4,000 international units. People do far less than that. I think the recommendations from the governments are usually around 400 international units a day. The difference may be because we're talking apples and oranges. We have very good data, very good research that goes back decades about exactly how much vitamin D we need for good bone metabolism. But as you know, I mean, just because you need so much flour for one recipe doesn't mean you need exactly the same amount of flour for a different recipe. And what we're talking about here is not bone metabolism. We're talking about immune function. And there are some experts that believe that the levels that we need should be higher. So let's talk about levels for a little bit. First of all, you have to be careful because there's two different scales that are measured. There's nanograms per milliliter, and then there's nanomoles per deciliter. So you have to be careful about that. The nanograms per milliliter is usually in the 20 to 30 range. And that's 30 is kind of where you need to be for good bone metabolism. Some experts believe you ought to be closer to 50 or even 60. And that's interesting because there was a study in the United States that looked at the incidence of SARS-CoV-2 infection related to vitamin D levels. And they found that as vitamin D levels dropped below 50, that's when we started to see an increase in SARS-CoV-2, regardless of where they lived in the United States, in the North or in the South, regardless of whether or not they were dark-skinned, light-skinned, male or female. It seemed to cut across all those different groups. So to review again, if you think you're at risk for vitamin D deficiency, spend a lot of time indoors, older, darker skin, high latitude, then supplementation with up to 4,000 international units a day probably would be beneficial, especially if you're not able to get a lot of sunlight and you're going through the winter months.
Yeah, there's a couple of things there which I found really interesting. First of all, I agree with you. I think we have very conservative recommendations for vitamin D based upon, as you say, the kind of historical nature of study, which has typically been around bone health. And I remember, Dr. Seheult, maybe 10 years ago or so, I was working in a practice in Oldham in the north of England. And there was some new vitamin D guidelines from the local health authority that, as physicians, we were meant to be following. And 0 to 10 was regarded as deficient. Yes, you should be supplementing and replacing. 10 to 20, I can't remember the exact wording, was something like insufficient or suboptimal, consider replacements. And then 20 to 30, optimal, no need for action, which is really interesting because, you know, as you say, we're now talking about potentially, if you're under 50, potentially your immune system health is not as robust as it might otherwise be. So I think this really speaks to something else in medicine, which I feel we need to evolve somewhat, is rather than black and white, this is abnormal and this is normal. It's like, well, okay, but what about optimal? What is optimal for what we are looking for? So that was one point I wanted to just to raise, which I found really interesting. But then I think the other point is, we say for those at risk of vitamin D deficiency, But as you say, some people who take even 4,000 units a day are still going to be low on their blood levels. And there's all kinds of factors why that might be. I know that there are some genetic variants with the VDR receptor that might make it more difficult for those people to have adequate levels of vitamin D in their bloods. But many of us, we all work indoors these days, talking about the Northern Hemisphere. So here as we have this conversation at the moment, it is September. You're in America, I'm in the UK. We're at the tail end of the summer. We are now coming into autumn and winter when actually we're more susceptible to these viruses. So you kind of feel, yes, I've got dark skin, right? So I'm going to be one of those people who needs much more sunlight to get the same level of vitamin D. But I guess we could start to make a case that, yes, there's people at risk, but it doesn't take a million, it doesn't take so many steps on our head to go, well, there's a case potentially that all of us might benefit. Do you know what I mean?
Yeah, absolutely. Absolutely. Totally. And that's where we are headed in medicine. We're headed to sort of specialized or medicine recommendations specialized to us individually based on our genetics, based on testing, based on all sorts of things. And this would be no exception. I think if someone is really concerned about the potential possibility that they have vitamin D deficiencies, is get tested.
I mean, it's a very simple, cheap test to do. The supplementation is very cheap as well. So I think that's a really good recommendation. Some people say that you don't need to supplement. You can get this sort of stuff from food. I'm not convinced that we can eat enough of the foods that contain vitamin D to actually get those optimal levels. But that's one thing I was hoping you might address. The other thing is that on an evolutionary basis, some people say, well, we're meant to drop our vitamin D levels over the winter because we wouldn't have been outdoors as much. So how does that shape your thinking somewhat if people make those arguments to you?
Well, first of all, in terms of dietary, I think you'd have to eat a lot of mushrooms. I know fish and chips is very, very popular in the British Isles. You'd have to eat a lot of fish to get it. I think supplementation is probably the best thing to do. Along the lines of dietary, though, I would make this point. Here in the United States, we have this very poor, bad, fatal attraction to fructose corn syrup, high fructose corn syrup. It's sort of the sweetener of choice over here. And unfortunately, it's probably one of the worst that we can have. There's been a number of studies that have shown that high fructose corn syrup can inactivate vitamin D and its effects downstream. So even though you might have good levels, consuming a lot of high fructose corn syrup is not a good idea. And I would just ask, if you pick up a can of Coke or Coca-Cola, I guess you guys call it pop or soda. I don't know. We call it cola. It's going to be sweetened with high fructose corn syrup if it's purchased in the United States. Do you know is it cane sugar? What do they use over there in Europe?
Yeah, I think it is. It's definitely not high fructose corn syrup over here. But I think what you're saying really speaks to, as you call it, this Swiss model approach, which is, you mentioned right at the start that the immune system uses inflammation as one of its tools to help us fight off whatever we're fighting. And you've mentioned vitamin D, but also now you're speaking to food, right? And where do we get high fructose corn syrup? It's typically in highly processed foods. So maybe we don't have high fructose corn syrup here as much in the UK and Europe, but we do have lots of highly processed foods that are potentially driving inflammation in our bodies and may also be having a similar role potentially.
Yeah, I would love to talk on that. But to get back to your second part of the question, in terms of the evolutionary role of that, it's an interesting topic because the whole world is not under that same pressure. So if we go to the equator, my father's family is from Trinidad. And so that's about as close to the equator as you can get. You just have a rainy season and a dry season, but the sun pretty much sets every day at 6 or 7 o'clock. And that's very different, of course, when you're up in the Nordic countries in the far north. Well, I've been thinking about this, and if there was a disadvantage for those people living at those high latitudes in terms of vitamin D, I find it very interesting that these same cultures that live at those very high extremes have found, I believe, ways of compensating for that vitamin D deficiency. And this is a whole nother topic of discussion. But you notice that the cultures that, like for instance, the Swedes and especially the Finns, use a lot of this hot and cold sauna and bath type of things, which have been shown very clearly to be immuno-enhancing activities. You don't see that activity, of course, in cultures that are living in the at the equator. So maybe more anthropological than evolutionary, but I think that it's interesting that these cultures that have lived there, I mean, for thousands and thousands of years, have come up with these ways of dealing with illnesses that they might get because of a said vitamin D deficiency.
So far, we've talked about sleep. You've given some practical advice on sleep. We mentioned stress and fear. You've mentioned how moderate exercise can absolutely massively reduce your risk of getting infections, improve how your immune system functions, improve your well-being. Before we get on to food then, to finish off, what other things can people do, or do you recommend, to help them reduce that stress in their life, which of course can be very, very hard?
Yeah, I mean, so the question is why do we have fear in the first place? And if and I'm informed a little bit by my upbringing as well, is being able to have a place to put those kinds of burdens. So there's the spiritual aspect, which is well known in medicine, and what we do, and having that ability to rest. So as a Seventh-day Adventist, I take a day off a week where I basically disconnect from all of the worries of work and all of these sorts of things. And I can't see why anyone wouldn't do that. I mean, a lot of times we have to do things. There's stuff that has to be done outside, and that list never goes away. There's never a point in my life where my work queue is zero and I can say, I'm done, I can go away. And so if you're waiting for that period of time where your work queue is done, to be able to just relax and detach, guess what? You're never going to have that. You are, as a human being, are going to have to take the initiative and say, here's a period of time during which I am not going to be working in my work queue, and I'm going to be able to disconnect from society and actually take care of myself and have a place where I can develop, whether it's spirituality or religiosity, these sorts of things where I can improve my family relationships. These are so important when we look at the research. People who do well, people who live longer. If you look at the research that Dan Buettner has done with the blue zones, I mean, there's always a connection of community. It's not just your immune system. It's not just your sleep. It's also your connection to people around you, knowing that there's a support system there, knowing that there are people that can help you. This is so important. We are, there's this expression, no man is an island unto himself. And so from this, we look at the community. We look at our connections to people outside of ourselves. We look at our parents, our children, our relatives, our spiritual leaders, our God, whatever that is in each one of our lives, and making sure that we have time for that. That has a tremendous effect on our ability to process fear, of being able to process anxiety. And actually, there are practical ways that can be helpful. Obviously, if there's a specific problem that you don't know how to deal with, if you're part of a community, maybe that can be helpful in actually taking care of the problem. But if it can't, we know that people who have diseases, they do better when they're in support groups with people with the same disease. So I think this is a huge area that for some people is obvious, for others are not so obvious. And so I'm glad that you pointed that out and asked that question, because I think that there's a tremendous amount of benefit that can be gotten from that type of program. The other thing that I would mention, we mentioned this last time as well, is this whole idea about circadian rhythms and our ability to make sure that we're doing what we're doing. We've talked about the circadian rhythm. There's also this circaseptan rhythm where we've talked about last time, where and scientists have looked at this, the biology, where there is, whether it's our heart rate, whether it's our body temperature, there is this 7-day cycle that's sort of built into our cells. and built into our body. And we don't know why this is the fact, but for some reason, we seem to go every 7 days. I mean, I have my ideas spiritually about why that's the case. But if you look in nature, there seems to be this need for every 7 days to take a break, no matter what culture it is.
I love that. So interesting. And I really appreciate you sharing your own upbringing and your own culture, because of course, culture plays into health massively in terms of our understanding, our practices, what we consider normal. And it again speaks to society and how society is in many ways working against us. We've kind of had these periods of downtime eroded out of our lives. So it takes people like you to have a really strong upbringing and culture to fight against that. I remember as a kid that the supermarkets weren't open on a Sunday. You couldn't go and buy your shopping on a Sunday. So everyone knew you had to get all the shopping done before. Sunday was a family day, right? You're not out. And now we've got, I'm sure it's, probably coming from America, but malls that are open 24 hours a day, 7 days a week. You can shop wherever you want, any day. We don't have that natural downtime built in. So I think it's a great point. I really appreciate you sharing that. Roger, I want to thank you once again. You're so generous with your time. Of course, you make fabulous videos for people on MedCram, where you're trying to educate the public and doctors about all kinds of aspects relating to our health. You have a brilliant way of simplifying information and sharing it with people. So I want to thank you once again for that. Just to finish off today then, we've been talking about inflammation. We've been talking about, I guess, primarily these 4 pillars: sleep, stress, exercise, and food. Have you got any final words of wisdom for people who are watching or listening and thinking, I'm worried about chronic inflammation. I don't want to get sick when I get older. What are some of the sort of top things that I can do and focus on to keep me well?
Yeah, let's just review some of those things. Is making sure that you're getting bright light exposure in the morning, making sure that you are not getting bright light exposure in the evening. This is going to allow your circadian rhythm to advance and allow you to get that sleep that you're going to need and not have the anxiety of not falling asleep at night. Is making sure that you're restricting your feeding, or I should say eating, to 10 hours, 8 to 10 hours if you haven't done so already. Making sure that you're looking at your personal schedule and incorporating exercise somewhere. Better to do it in the morning if possible, but in the evening time is better than not doing it all. I think exercise is really important. It also helps with sleep as well. We've also talked about mental stress, and especially now that we're going into this period of time again, potentially with the pandemic and all of the things associated with it and all the things that are going around in the world, is making sure that you're part of a community, making sure that you're giving time for yourself to rest and to recuperate and to recover, because nobody is going to do that. There's a lot of demands that are being asked of you, especially if you're in a productive environment, if you're at a job. No one's ever going to say, hey, you need to take some time off. You need to make some time for that yourself. Otherwise, it's not going to happen. So I think those are the low-hanging fruit there, Rangan. It's up to us to do it. And here's the other thing is we have to make sure, and you'll notice this in a lot of these things that we've talked about today, is that our frontal lobes have to be able to sort of say yes and no. We have to sort of take control of the situation. Otherwise, society is going to sway us back and forth. We have to be able to say, no, I'm not going to eat during these hours because I need to do my time-restricted eating. No, I'm not going to get up and look at television or look at the thing because this is not the right thing to do. So for those of us that have that very strong internal locus of control, these are the things that we can do. For a lot of us, and I may be one of those, we don't have a very strong internal locus of control. What we can do is we can talk to our loved ones, our spouses, our friends, and say, hey, this is what I want to do. Hold me accountable. Make sure I'm doing these things, because I think we all want to do it, but sometimes, as they say, the spirit is willing, but the flesh is weak.
If that conversation resonated with you, here is another incredibly powerful one that I really think you're going to enjoy. Give it a click and let me know what you think.
This is probably the most effective diet that's ever been promoted on the planet. This protects our body against decay, disease and the root causes of aging is not only good for you, but will make you live longer.